A neck strain or sprain happens when one or more muscles, ligaments, or tendons in the neck become injured. The cervical spine boasts a broad range of motion in various directions, thanks to a complex network of muscles, ligaments, and tendons. Large neck muscles, such as the sternocleidomastoid and trapezius, facilitate major motor movements in the neck. The trapezius, which is a large, triangular muscle, links the back of the neck to the shoulders. When a neck strain occurs, it affects the cervical muscles and tendons. These are fibrous tissues that attach muscles to bones. In contrast, sprains impact the ligaments, which are fibrous tissues connecting the vertebral bones, providing stability to the joints. Neck strains and sprains happen when these soft tissues are stretched beyond the normal range or torn, leading to pain, tenderness, and difficulty in moving the neck. For instance, a strained trapezius muscle can cause neck pain to radiate into the shoulder, shoulder blade, and upper back. These injuries can arise suddenly from incidents like car accidents that jerk the head forward and backward in a whiplash motion. Additionally, they can develop gradually due to poor posture. Or sleeping awkwardly. A muscle strain in the neck might also result in inflammation around the injured area and neck muscle spasms, as the body attempts to stabilize the injury. These spasms can be extremely painful. While many neck strains or sprains improve within a few days, some cases might experience flare-ups or persistent aching pain that can last for weeks. Here's a simple technique to help alleviate a stiff neck. Gentle neck stretch. Slowly tilt your head forward, bringing your chin toward your chest. Hold this position for 15 to 30 seconds, feeling the stretch along the back of your neck. Side neck stretch. Slowly tilt your head to the right, bringing your right ear toward your right shoulder. Then to the left. Hold this stretch for 15 seconds. Repeat on the left side, bringing your left ear toward your left shoulder and holding for 15 seconds. Neck rotation. Turn your head gently to the right, looking over your right shoulder. Hold this position for 15 to 30 seconds. Repeat on the left side, looking over your left shoulder and holding for 15 to 30 seconds. Shoulder roll. Slowly roll your shoulders backward in a circular motion 5 to 10 times. Repeat the shoulder roll forward 5 to 10 times. Additional tips: heat therapy. Apply a warm compress or take a warm shower to help relax the muscles. Proper posture. Maintain good posture throughout the day, especially while sitting or using a computer. Stay hydrated. Drink plenty of water to keep your muscles hydrated and functioning properly. By performing these gentle stretches and following these tips, you can help relieve a stiff neck and improve your overall neck mobility. Thank you for watching. We hope these tips and techniques help you find relief from a stiff neck. Remember, regular stretches and good posture can make a big difference in preventing neck pain. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more health and wellness tips. Don't forget to hit the notification bell so you never miss an update. Stay healthy and take care.